Hi, everyone. Thank you. Thank you for joining in. It's episode 8, and we're gonna delve right in, and we're gonna be looking at exercise as medicine, focusing on muscle, movement, and metabolism. Hi, everyone. Welcome back to tonight's episode. We are going to be continuing our series on why are so many people sick today. And tonight's topic is one that I absolutely believe is foundational: exercise as medicine. And we're going to be focusing on muscle, we're going to be focusing on movement and metabolism. Now, let me open with this question: what if one of the most powerful medicine for insulin resistance, type 2 diabetes, high blood pressure, high cholesterol, joint pain, chronic inflammation, and even shorter lifespan was something many people already have access to but are not using consistently? I am not talking about a new drug. No. I'm not talking about a miracle injection. No. I'm not talking about another expensive supplement. I am talking about movement. I am talking about exercise. I am talking about building muscles and preserving muscles. Because the truth is this: many people still think exercise is mainly for weight loss, or for looking good, or for fitting into smaller clothes. But exercise is much more than that. Exercise is medicine. It changes the way your body handles sugar. It changes the way your blood vessels function. It changes your cholesterol and triglycerol levels. It improves insulin sensitivity. It strengthens your muscles and joints. It reduces pain. It improves mobility, and it helps support a longer, healthier life. And so tonight, we are going to talk about why so many people are sick today through the lens of muscle loss, physical inactivity, poor movement, and metabolic dysfunction. And most importantly, we're going to talk about why you can begin to do something about it today. So if you're joining me live, I want you to type in the chat: exercise is medicine, right? Let's jump right in. For those of you who are new here, I am Dr. Olubumi Balaji, a board certified internal medicine physician, and I am passionate about helping people understand how to protect their health before diseases take over their lives. Now, one of the biggest problems in modern society is this: many people are living in bodies that are under muscled, overfed, under recovered, inflamed, insulin resistant, and physically deconditioned. Now, we live in a time when life has become more convenient, but in many ways, we have become weaker. We sit more, we walk less, we lift less, we stretch less, we sweat less, and over time, many people slowly lose muscle without even realizing it. Then one day, they're told, hmm, you have prediabetes. Oh, now you have type 2 diabetes. Or Now your blood pressure is high, your cholesterol is high. Now your knees hurt, your back hurt. Now you feel weak and you're tired all the time. And the question becomes, like I said to someone today in my discussion with him, how did we get here? So you may be asking yourself, how did I get here? For many people, it did not happen overnight. It happened slowly through years of inactivity, muscle loss, poor habits, and metabolic decline. And so, first, we're going to be looking at exercise as medicine. When I say exercise is medicine, I do not mean it replaces every medication in every situation. No, this is not what I'm saying. What I am saying is this: exercise has real, measurable effects on the human body. Okay? It directly affects multiple organ systems, and those organ systems that it targets can help to improve chronic conditions that many people are struggling with today. Now, exercise can help improve blood sugar control, insulin resistance, it helps with blood pressure regulation, cholesterol metabolism, body composition, mobility, it helps with strength, it helps with balance, and the cardiovascular health. Now, that means exercise is not just a side recommendation, it is not a casual suggestion, it is part of a treatment. And honestly, in many people, it should be treated with the same seriousness as your prescription medicine. Because if a treatment can improve your metabolism, can improve your blood pressure, can strengthen your body, can improve your endurance, can improve your mood, your joints, and your long-term health, then we should stop treating it as an optional extra thing that we have to do. Now we're going to be focusing on muscle, which is the missing piece. Now, let me say something very important here. Many people are not just overweight, they are under muscled. And that matters more than many people realize. Muscle is not just about appearance, muscle is metabolic tissue. Okay? Now, your skeletal muscle plays a major role in how your body handles glucose. The healthier your muscle is, and the more you use it, the better your body can manage blood sugar. So, muscle helps with glucose disposal, stability, balance, strength, joint protection, mobility, and a healthy aging. And this is one reason I believe we have to stop talking about only weight loss, because a smaller body is not always a healthier body. What we should really be aiming for is a better body composition, more strength, better movement, and better metabolic health, especially as people get into the middle age and beyond. Muscle becomes even more important because muscles hmm, protect functions. Okay? The muscle protects independence, Muscle helps to protect against a condition called frailty. Muscle helps to protect against falls. Muscle helps to protect the metabolic health. So when somebody tells me, Doc, I just want to lose weight, my answer is I want more for you than that. I want you to become stronger. I want your body to become more capable. I want you to build a body that can defend your future. So, how possible is this? Now, let's look at muscle and how it affects insulin resistance and type 2 diabetes. This is one of the clearest areas where exercise acts like medicine. Now, when your muscles are active, they use glucose more effectively. And over time, regular exercise helps improve insulin sensitivity. And that means your body becomes better and able to respond to insulin and regulate blood sugar effectively. This matters because many people today are walking around with signs of insulin resistance and do not fully recognize it. They may have what we call a pot belly, increased belly fat, sugar cravings, fatigue after meals. After you eat your lunch or your dinner, you fall asleep. Rising triglycerides, low HDL cholesterol, increasing waist size. For women, more than 35 inches. For men, more than 40 inches. Or an hemoglobin A1C that keeps creeping upwards. And what happens many times? Instead of addressing the root, and which is the lifestyle drivers, people just keep moving further down the disease pathway. Okay? But exercise helps to disrupt that progression. Aerobic exercises helps improve your cardiovascular health, fitness, it increases energy expenditure, and it improves glucose use. And so also resistance training helps to build muscle, improve insulin sensitivity, and improve how the body handles sugar. And so this is why I tell people do not choose between cardio and strength training as though one is enough by itself for everybody. You need both. You need movement for the heart, you need movement for the vessels, the blood vessels, you need movement for energy expenditure, you need strength training for muscles, for insulin sensitivity, and long term metabolic support. And here is the encouraging part: exercise can improve your health even before dramatic weight loss shows up on the scale. I know many times we jump on a scale, we want to see the scale move, but you can start to enjoy the benefit even before you start to see a difference on the scale. And so I want you to hear me clearly. Now, exercise can improve your health even before dramatic weight loss shows up on the scale. So if somebody says, I have been exercising, but I have not lost a lot of weight yet, my answer is keep going. Your body may already be improving on the inside. Now we're going to look at how movement, muscle, affects blood pressure. All right. Now, exercise helps lower blood pressure because it improves the health and flexibility of the blood vessels. It supports weight management, improves cardiovascular conditioning, and improves overall circulation. So, again, movement is not a side issue here, it is part of the treatment plan. Now, does that mean every patient can throw away their blood pressure medicine? No. But it does mean many patients can improve their blood pressure control, reduce their risks, and in some cases, even reduce medication burden under the supervision of their provider. And this is why I get concerned when people are told they have hypertension, but no serious conversation is had about physical activity. Okay? Because if blood pressure is high, then movement matters, nutrition matters, sleep matters, stress management matters, weight management also matters. These are not optional details, they are part of the big picture. Now we're going to jump right to cholesterol and triglycerides. Let's look at how exercise can help. Exercise helps here too. It can improve your triglyceride, which is a type of cholesterol that we always, we check when we do your lipid panel. It can support a better HDL levels, which is we call it the good cholesterol. It can improve insulin sensitivity. It can reduce visceral fat, which is that ugly fat around your major organs, and improve the overall metabolic environment that often contributes to poor lipid patterns. Now, let me be clear and balanced. Exercise by itself does not always produce a dramatic LDL reduction in every patient. Nutrition still matters greatly, and genetics matters too. Okay? Now, but movement still plays a major role. And this is why when somebody says, my cholesterol is high, what should I do? The answer should not just be, take this pill and keep living the same way. No. The bigger question should be, what kind of metabolic environment has this person been living in? All right. Have they been sedentary? Have they lost muscle? Are they insulin resistant? Are they inflamed? Are they sleeping poorly? Are they eating in a way that drives metabolic dysfunction? Now, exercise helps shift that environment in the right direction. Of course, it's not the only story, as we've been saying. We're going to look at the effect of exercise on joint disorders and chronic pain. I want, I want to address a very important group of people. Those who say, Doctor, I would exercise, but I'm in pain all the time. So maybe your knees hurt all the time. All right. Your back hurts all the time. Your hip hurts all the time. Or maybe you have osteoarthritis. And so, because of that, you assume exercise is going to make everything worse. Now, let me be wise and balanced here. There are some patients who need, of course, imaging studies. They need a proper diagnosis to find out what is going on in their body. Some may need physical therapy to help manage their pain, and some may need medications. But in many chronic musculoskeletal conditions, the answer is not lifelong avoidance of movement. That's not the answer. In fact, many people with chronic pain do better with the right kind of movement. Why? Somebody would ask. because appropriate exercise can strengthen the muscles around the joint, improve stability, improve circulation, that's blood circulation to the area, reduce stiffness, improve mobility, and reduce the fear of movement. Now, a weak body often hurts more. A stiff body often hurts more. A deconditioned body often hurts more. So, the goal is not reckless exercise, the goal is smart movement. And these may look like walking, pull exercises, chair exercises, resistant bands, gentle strength walk, mobility walk, balanced drills, or physical therapy based training. And sometimes the path out of chronic pain is not doing less, it is learning how to move better, more consistently, and more safely. Now, the last section that I want us to look at is how movement affects longevity. And yes, I mean long life, longevity. One of the most consistent finding in health research is that people who are more physically active tend to live longer. Not just athletes, not just extreme fitness people, ordinary people like you and me who move regularly. This is important because some people think if I cannot do a full gym program, then why even bother? But this is the wrong mindset. Even modest movement is better than none. Walking more matters. Even improving your daily step count matters. Even strength training twice a week only matters. You know? And the body responds with a consistent signal when we do this. And movement sends one of the most important signals of all: stay alive, stay capable, stay adaptable. So say no, you do not need to become a fitness model, but you do need to stop making peace with chronic inactivity, because inactivity, which means doing nothing, is costly. It costs strength, it costs endurance, it costs mobility, it costs metabolic health, and over time, it can cost quality of life. So, what should people actually do? Let us make it practical. If you're listening tonight and wondering, okay, Dr. Balaji, I've been listening to you. What exactly should I do? Here is a simple, proven framework. Number one, walk daily. Walking is one of the most underrated form of medicine. It helps with blood sugar regulation, cardiovascular health, energy, blood circulation, and consistency. So start where you are. If you can do only 10 minutes, start from there. If you can walk after meals, even better. You hear me say this all the time. Number two, strength train at least 2 days a week, 10 to 15 minutes. It doesn't have to be an hour. Use the bands and weights. You can do this in the comfort of your home while watching TV. This is especially important for people who are middle aged and older. All right. We're gonna talk also. We'll talk about use the body weights, use bands, use dumbbells. You know, train your muscles. Very, very important. We can focus on major muscle groups. You can do legs today. You can do your glutes tomorrow, or legs and glutes one day. Do your back, the chest, the shoulders, and your core. Number three, prioritize your lower body strength. Your legs are critical for metabolism, for mobility, and function. So, what can you do? Chair squats, sits to stand, step ups, supported lunges, and hip hinges. So, these are types of movements that you can do to support your lower body. Strong legs, they helps to support a strong future. I'm going to say that again. Strong legs helps to support a strong future. Number four, add aerobic conditioning. And what are we talking about? Brisk walking, cycling, swimming, getting on the elliptical, low impact cardio, dancing. All right, so you can gradually build this regularly, and and just incorporate it into your weekly activities. Number five, break up long period of sitting. Some of us, our job entails sitting for such a long time and we don't even get up. And this is a big one. Do not sit for hours and then expect one short workout to erase all that pattern. No. So you want to take time, stand up, stretch, walk around, move intentionally throughout the day. Get up, break that pattern. Okay? Number six, train balance as you get older. Okay? Very, very important. Balance does matter because it helps to prevent falls and improve confidence in movement. Okay? So we want to work on stability, we want to work on coordination, we want to work on simple balance and do some safety drills, especially when you're older. Number seven, you want to progress slowly and consistently. Do not let you, your enthusiasm cost you to overdo it in 1 week and then quit the next week. Okay? Go slow enough to stay consistent. Number eight, match the plan to the person. Not everybody starts in the same place. Know yourself, know your body. A patient with obesity and knee pain may need a chair based or a pull based plan first. Okay. And a patient with insulin resistance may do well with walking plus strength training. And older adults with weakness may need supervised basic resistant exercises. So the key principle is this: individualize the method, but do not abandon movement. Keep moving. And so, what is the mindset that I want you to have tonight? I want to encourage somebody that is listening to me tonight. Maybe you feel behind. Maybe you feel discouraged. Maybe you feel like you've waited too long. Maybe you're saying, I am too busy, like many of us say. I am too tired. I hear that a lot too. I am too old. I do hear that too. Or I am too far gone. I want to tell you this, and this is with all sincerity. It is not too late to begin to improving your health and starting in the right direction. No, you cannot rewrite the past. No, but you can absolutely start changing the future from today. So, your body responds to what you do repeatedly. So, begin to walk, 1 week of consistency, one strength training session, one better routine, and then repeat it. And over time, this is how stamina improves. This is how blood sugar improves. This is how blood pressure improves. This is how pain may improve. This is how confidence improves. This is how health begins to turn into a better direction. Now, you do not need perfection, you need consistency. And so, as we close tonight, I know I have taken a lot of your time and I thank you so much. I want you to remember this: exercise is not punishment, it is not just cosmetic, it is not just about losing weight, it is not only for the athletes. Exercise is medicine, all right? It helps the muscles, it helps the metabolism, it helps the vessels, it helps the joints, it helps the brain, it helps the future, and it helps to produce a better version of you. If we want to understand why so many people are sick today, we must face the truth that many people are living in chronic inactivity, progressive muscle loss, poor movement pattern, and metabolic decline. But there is good news. The body can respond, the body can adapt, the body can get stronger, the body can become more metabolically healthy. So make a decision, move on purpose, build muscles on purpose, protect your metabolism on purpose, and age with strength on purpose. Because movement is medicine, muscle is protection, and exercise is one of the most powerful investment you can make in your health. And thank you so much for joining me tonight for episode 8. If this message has helped, encouraged, and challenged you, please like, share, and subscribe. And I want you to, I see a couple of comments already. Put in the comment, I choose movement. And thank you so much for being here. I truly appreciate you all. And I will see you in the next one. I'm going to see if anyone has any questions here and see if I can answer one or two before we end this live tonight. I hope I've been able to encourage somebody to move more. All right. I hope I've been able to encourage somebody tonight that exercise is not punishment. It's not just for weight loss. It's the key to living a long life, a pain-free life, a disease-free life. All right. Thank you. I see a lot of comments here. Exercise is medicine. Exercise is medicine. Thank you so much, everyone. Exercise is crucial. Yes. Slowly but surely. Yes. It would really give me a lot of joy if we start incorporating one or two things from tonight into our daily routine. Like I said, start slow, start small, but be consistent. And yes, God bless. I will see you next week in the next one, episode 9. All right. So please join me next Saturday at 7 p.m. Please send this to anyone that you love and may need this information. Thank you so much. Thank you, everyone. Yes, I see I choose movement. Thank you. We should all choose movement. Enjoy your evening. Thank you. Thank you so much. Thank you, everyone. I do appreciate all your comments. All right. Have a good evening. I'll see you next one in the next one. Thank you.